In today's health headlines, what to know about the COVID summer surge. The first case of measles since 2020 has been reported, and an update on the bird flu. Joining me is Dr. Albert Shaw, Yale Medicine Infectious Disease Specialist and Professor of Medicine at Yale School of Medicine. Welcome.
Thanks for having me.
You bet. All right, the spiking COVID cases this summer may still be bothersome, but the majority of people will not get severely ill. I hear everybody has it these days. Tell us about it.
Yeah, we're definitely seeing more emergency room visits for COVID, more detection of the COVID virus in municipal wastewater, including here in Connecticut. So that's correct that I think most folks, because of previous infection or vaccination, will have mild disease, but this is still a significant risk in older adults over age 65, those with pre-existing medical conditions. Those individuals constitute about 2/3 of the folks that are being hospitalized right now. We have ways to address it. You know, Paxlovid will definitely help diminish symptoms, diminish the risk for progression in these kind of high-risk individuals. And high-risk individuals that think about still vaccines. It's been recommended since February that high-risk individuals should get an extra dose of the bivalent booster. Very few people have gotten it. If you're in that situation, you may want to discuss with your healthcare worker whether you should get it, depending on your travel plans, summer gatherings, keeping in mind that we're expecting an updated version of the booster in a couple of months.
All right, we'll wait to hear about that. Massachusetts has confirmed its first case of measles since 2020. Should we worry about this as a neighboring state?
You know, there's been, I think I counted now, this is the 168th case of measles in the country, but that's already more than we had in all of last year. They've occurred in about half the states in the country. And looking at the map, it looks like measles outbreaks have occurred in every neighboring state of Connecticut except for Rhode Island. So I think we've been fortunate that this is a highly contagious disease, probably the most contagious viral disease that's out there, preventable with a safe and effective vaccine. At best, cause a highly unpleasant illness, and rarely at worst can cause lasting neurologic damage or even death. And I'll say that of the 168 cases, about 84-85% have occurred in unvaccinated individuals or in someone who the vaccine status was unknown. Now, a lot of times it's because babies can't get vaccinated or don't get vaccinated at about a year of age, but it's definitely something to keep in mind, making sure we're up to date on our measles vaccines in our state.
And finally, a cluster of 5 workers were infected with bird flu, and extreme heat may be a factor in the spread of this virus. What can you tell us about that?
Yeah, I think this occurred in the context of a bird flu outbreak on that particular farm in Colorado. And because bird flu is not curable in birds, the only measure to prevent spread, unfortunately, is to cull the herd. And I think that's where the stories about heat occurred, because it's just really difficult to wear the personal protective, bodysuits and masks that are necessary to prevent exposure when culling the birds, unfortunately. So I think that's probably where the exposure is thought to occur. This is an ongoing pandemic that has been going on in birds since 2022. We've had detection of the virus in Connecticut back then in a backyard poultry flock, but we've had it detected in wild birds this year as well. It's an ongoing situation. The same virus seems to be also spilling over to dairy cattle as well. We've spoken about that. I think it's a case where the risk to the public is low, the food supply is safe, but we need a lot more resources to understand the extent of the spread, particularly in potentially exposed farm workers.
All right, Dr. Shaw, thanks so much for all the important information.